kushirikiana na CDC tekeleza wajibu wa kusaidia angamiza HIV kwa nia moja. LBCT katuleta moja, tukaungana, brought us together under the umbrella. We stand together and fight against this disease. Ungana, simama pamoja, kwa umoja. Ungana, pamoja. We stand together and fight against HIV. Ungana, yeah, hey. Ni mengi tumefanya kuyawezesha mashirika kujisimamia, kujitegemea na kusimama kipekee, kujiinua na kujiendeleza. Tuliyofanya mengine ni mazuri, but we look into the future. Tuwaze jinsi ya kufanya zaidi. Ungana, simama pamoja, kwa umoja. Ungana, pamoja. We stand together and fight against HIV. Ungana. Ungana. Thank you.
WPC is a faith-based organization, and we are working in the lower eastern region of Kenya, more specifically having strategically positioned ourselves along Mombasa Road. We have 3 sites, from Athi River, Emali and Mutitwandi. And before Ungana started, WPC totally it was like operating from home.
A Highway Community Health Resource Center is a non-governmental organization that targets long-distance truck drivers and also highway users. That's why you can see this long truck here. So our sites are strategically located at the Northern Highway Corridor, where the truck drivers stop. This is at the way bridges and at the border points because they have to stop there. And besides the truck drivers, we also target the female sex workers and any other communities that surround the highway corridors. So on this resource centers, we offer testing and counseling. We've tested over 58,000. And we also have distribution of information, education materials, and education too for materials that truck drivers can understand. Some in pictures, some in Swahili, because that is what they can understand more. And we also train and educate them about condom and condom use, and distribute condoms to them. And we do a lot of peer education because truck drivers don't have a lot of time to receive these services. So we work with a few to reach more.
We have got HIV and AIDS interventions in HIV and AIDS interventions, which we are doing here in Better Poverty Eradication. We started by having general population integration, where we had gone all over the county, trying to train people on or creating awareness of HIV and AIDS prevention interventions. Then later on, we started with another program we called Family Smarter program, where we found that we are training parents of young children of 9 to 13 years on interventions on how they can communicate with our children on HIV, AIDS, activated sexuality, free with no problem. We had to equip them with information that we are going to give their children. We had also created some strength to them so that they are able to communicate with their children. And in that intervention, we are able to get a number of parents who are trained, about more than 20,000 people. Parents were able to be reached, including their children.
We work with persons with disabilities, reaching 30,000 with services. We also work with the county governments of Makueni, Machakos, and Kitui, where we capacity build health workers to be able to provide services to about 1 million people and 48,000 who are tested HIV positive, with 80%, beyond 80% who are linked to care and treatment. From this other side, you'll be able to see the overall achievement of the Ungana project, where we had about 1.8 million people. Please, if you may come this way. We had about 1.8 million people who are reached with the services, and also capacity building for grants, being able to raise more grants. And we are hoping that as an organization we'll be able to utilize the same model to go beyond Kenya, to go to other countries in Africa, and be able to replicate this same model. So we are very grateful to all of you for the support you have provided for us to be able to utilize this grant and to reach the population of the organization. We are very grateful. Thank you very much.
When we acquired the track, now it's been easy to do or even have 2 activities in one day.
How much does this truck cost?
This track was around 5 to 6 million, thereabouts.
This is all cabinet work, eh?
And actually breathe.
Yes, but the best thing, as we brief people, you know, it's a circle of activities. There's someone who's just coming, checking their pressure, doing their hemoglobin, filling the questionnaire. So it's a circle of activities. So at any one given time, all the places are full.
Okay.
Allow me at this moment to welcome each one of us to this place. First of all, we are privileged to have our chief guest, Dr. Nduku Kilonzo, the director of the National AIDS Control Council. I've said it well, I believe so. And with us also, we are privileged to have Engineer Patrick Obath, who is the chairman of the board of LV City Health. We are also privileged to have Dr. Mary Mwangi from CDC Kenya, who is representing CDC this morning. And we also have our director, Dr. Wanjiru Mukoma, with us, apart from you and me. Over the past 10 years, PEPFAR through LV City Health has been very supportive of local organizations. And this eventually culminated into LV City Health being given a grant to help build the capacity of 14 local organizations. And what has happened is that over the past 5 years, through LV City, PEPFAR has been able to grant well over $500 million shillings to these organizations. And today we are here to celebrate their success. So allow me then, without much ado, to welcome at this time Dr. Mukoma, who will introduce to us the chief guest, who needs to leave not very long hereafter. But otherwise, all of us feel welcome. I know we have guests from Makueni, from Machakos, and many, many other places. Please don't go and tell anybody that you are not acknowledged. God bless Dr. Mkoma.
Good morning, everyone. Our chief guests, Dr. Nduku Kilonzo, Director NAC, Dr. Mary Mwangi, representing Country Director CDC, and Patrick Obath, the board chair, Engineer Patrick Obath, the board chair for LVCT Health. Ladies and gentlemen, distinguished guests, hamjambo. Karibuni sana kwa sherehe hii ya leo, ambapo tunasherekea matokeo mema ya Ungana and the sub-partners of Ungana. I'd like to start by acknowledging that the Ungana project actually started under the tenure of Dr. Nduku Kilonzo when she was the Executive Director, LVCT Health. So she's very much part of the celebration that we are having today, and we are very pleased to have you here to celebrate this with us. So I'm going to speak very quickly through a presentation on the capacity building Ungana project. I'm not going to say a lot of detail because if you go to the exhibition, if you haven't been there already, please take a moment during the breaks and go to the exhibition where the partners are explaining what they do in much more detail and doing it much more justice than I could in a presentation. So I'm going to just give us a very few highlights about the Ungana project, and we can hear more from the partners at the exhibition booths. So LVCT Health, as you've heard, we've just rebranded, so we have a new vision, which is healthy societies, and a new mission. And our work is around HIV testing and counseling, which has been the flagship of our work for the last 13 years, and we are continuing to work in that area. HIV prevention and sexual reproductive health for key populations and vulnerable groups, HIV care and treatment. We have care sites in Hurlingham and Kisumu, but we also support public health facilities, 113 of them. We're also involved in GBV and post-rape care services and strengthening health systems for service delivery, which is what the Ungana project is all about, and utilizing the experiences from all these programmatic areas to inform policy advocacy in the country at national level and now for implementation of policy at the county level. You'll excuse me, I will skip through some of these slides. This is how we work as an organization. We have a model which we call the Hatua Research Policy Practice Model. We undertake research or utilize existing research evidence to inform our programming and our service delivery, as well as to inform policy, and we implement within the national policy frameworks. Our presence is in the counties shown here. And I'll speak now about Ungana project, highlighting some of the achievements of this project. The Ungana project was funded by PEPFAR through the Kenya CDC Kenya for the period 2009 to 2014. So what we are hosting today is a closeout event of a very successful 5-year grant that was CDC funded and working in partnership with government and the sub-partners. The objectives were to strengthen organizational systems for local organizations as well as for the Ministry of Health, and to provide technical support to scale up HIV prevention services in the programmatic areas that you've heard of in the short documentary. The project's coverage was 492 MOH health facilities, and this was to scale up provider-initiated testing and counseling, PITC, in Machakos, Makueni, and Murang'a, and working with local organizations in Nairobi, Kiambu, Machakos, Makueni, Murang'a, and Homa Bay, and this was really to give them the support to strengthen their technical areas and the organizational systems. This model is explained very well in the booth, in the exhibition booth, so you could look at it there. Let me highlight some results from the Ungana project. And I'll speak a bit about where the organizations were before and where they were after the Ungana project. Before we started the Ungana project, only 2 organizations had boards that held regular meetings, and only 1 had a strategic plan. Today, as we celebrate the achievements of the 11 sub-partners we are graduating, all of them have functional boards, and all of them have strategic plans, annual work plans, and other organizational policies such as HR, finance, procurement, that are not only on paper, but are actually in implementation. In terms of systems and policies, all the sub-partners have efficient systems and structures. They have M&E mechanisms. They have functional databases. They are reporting consistently to government as is required, and they're utilizing their data to inform decisions. We started off advertising to 165 organizations, and 165 organizations applied, and we shortlisted 18, selected 14, and we have ended up graduating to 11. You'll see some of those figures speak to 12 because one exited along the way. They have explained these achievements very well, again, in the exhibition booth, so I'll skip that and just speak about some of the achievements in strengthening systems. None of them had an accounting software when we started. Only 2 had finance policies, but they were not following them, and only 1 was regularly submitting their statutory deductions, and none of them had a complete asset register. At the end of 2014, all the sub-partners have a QuickBooks software system that they're using for their financial management. They have operational policies, and all of them submit their statutory deductions on time, and they have asset registers that will be verified as we go through this closeout process. The financial growth, I think Josh mentioned, we have sub-granted over over $500,000, and the sub-partners themselves, through the Ungana project, have been able to be trained and their capacity built in resource mobilization, and they have raised over $2.5 million. In terms of the MOH, we worked with the 492 facilities, and we trained more than 1,500 staff, and we also hired staff to support the facilities in task shifting and improve the quality assurance systems, and we were able to renovate some of the 492 facilities supported, testing over 1.15 million people. So these are the brief achievements of the Ungana project. I'd like to stop here just because we don't have much time, and I'd like you to clap for the achievements of the Ungana project. And invite the CDC representative, Dr. Mary Mwangi, who is here on behalf of CDC, to just give us a few remarks.
I'm here today to represent the CDC Kenya Country Director, Dr. Kevin Dikok, who could not make it to this function today, and also to represent the activity manager, who has presided and provided technical support to LVCT Health since the commencement of this grant. That is Patricia Oluoch. For Pat not to be here, it really means a lot to her. I spoke to her last night. It's like preparing, you know, for your daughter's or your son's wedding, and then on that day you're not there. I'm really hoping that I can be able to step in her shoes. I want to imagine if she had been here today, she would be immaculately dressed to celebrate your achievements, and she would probably spend close to 30 minutes. But I know Dr. Nduku Kilonzo is probably running to another engagement, so I will keep my remarks short. So basically, as CDC, we do not take partners that deliver results for granted. We are privileged today and very happy to join LVCT, the sub-partners, and all the collaborating organizations, including the Ministry of Health and other departments represented today, to really commend you for the work that you have done. I think perhaps we don't stop a lot of times to give ourselves a pat on our back, but I think it's good to pause and say a long journey starts somewhere. We've walked a very long journey. 5 years is not a short time, with huge targets, with partners, with the capacities that have been elucidated by Dr. Wanjiro Mukoma, and here we are today. One of the things that we are proud about LVCT Health, it is the unique and innovative capacity building model that you people embarked on. You are very systematic in designing a capacity assessment tool that enabled you to identify the unique strengths and weaknesses of the partners that you took on board. And using that, you methodically worked with organizations that lacked governance and leadership structures, that lacked financial and program management skills, and worked with them. And I'm proud that only one fell alongside the way, and that's a big achievement that we all need to commend you on. In addition to that, we are greatly impressed by developing their capacity is not enough. The outcome was really for them to be able to provide services to Kenyan communities. The numbers that we have seen today and the broad program areas that you worked in, and which I really want to commend you on. I don't think I'll go through a list of all of them, but I'm reminded that you have great strengths in areas that a lot of our partners are struggling in. And I want to specifically single out your work in providing HTC and prevention services to persons with disabilities. A lot of us are moving in HIV, assuming that everybody can hear, everybody can see, and that they are fine. I think this organization needs to be commended for really taking the tough journey to ensure that persons with disabilities access the services that other people access. I also want to acknowledge your great work in terms of couple counseling and testing. This is an area where we have been struggling a lot. I have not seen the kind of numbers that I have seen with any other of our implementing partner in terms of couple testing, couple HTC, and I want to commend you on that. Finally, my favorite subject, which is gender. I think you must be grateful that you had Nduku at the helm of this organization. I think gender and gender-based violence are areas that a lot of us recognize. They have a nexus with HIV. They have a nexus with the reproductive services we provide. But a lot of us have still not started to do a lot of work in that. I also want to recognize your efforts in terms of capacity building in the MOH facilities, over 400 facilities that you have actually worked in. But most important, I think I would not want to close my speech without saying that the grant may be coming to an end, but I really think you are competitive in terms of being able to advance and to grow this work, not just in public health, in HIV, but in other development areas. There are lots of opportunities for you to use the same skill sets to offer capacity building in other areas. And I want to encourage you to say that this is just the beginning of Ungana. This is the infancy period. What are you going to do to make sure that Ungana becomes an adolescent and, an old man with a lot of wisdom? So my challenge to you is Ungana is coming to an end. You have built the capacity of all the 12 organizations, including the one that dropped off. What is the way forward? I think you have that energy, you have the skill sets, you have competent staff who can be able to grow this organization to the next level. Finally, you need to be proud that you've given the country a NAC director. Although some of your staff will be leaving, I did not see you really showcase what you've been able to do with your own staff. Where are they now? Perhaps you would start with Dr. Nduku Kilonzo and many of the other staff who have left. I think in closing, I just want to commend LVCT Health, all the 12 partners, the MOH and other collaborating organizations, but most important from our CDC side, I would like to say thank you to CDC for availing the resources and the technical assistance that you needed. I hope we did not step on your toes, and I hope that we provided you with the support that you needed. Most important, I would like to thank Patricia Oluoch, who has stood with you since the inception of this grant and up to, and she will continue working with you on other grants that you have with us. She really sends her apologies, and this was not a function for her to miss, but unfortunately, she cannot be here. So with those few remarks, I think the work we do is very important. Let's try and do it extremely well. Let's try and do it with accountability, but most important, with humility. I think when we look at the faces of the people we serve, that is really should be our greatest pride. All these indicators that we are showing here, they are men and women, real faces, discordant couples, young people who have benefited from this program. To the extent that you have improved